Okay, everyone got all that? We're going to have a test. No, I promise, no test. I did just want to make one comment on one thing Roger said with respect to requiring if you get too much credit or too little credit. There is a reconciliation for individuals at the end of the year when you file your taxes, but there are some limits. So as long as you've completed the application with good faith estimates, there are limits to how much you'll be asked to pay back at the end of the year. So with that, now I want to, the next 3 slides are really dense. There's some things that you just need to be aware of. Nothing earth-shattering in these, but because you're small employers, because you may not actually use a firm like Roger's firm to do these things, they're just issues that are going on that you need to know about. The first one is very straightforward, a notice of marketplace options. And the way I refer to this is another of those water cooler notices that you need to have. So you know how you have those posters for minimum wage, and maybe you have some workplace safety posters. Each year now you're required to send out a letter letting folks know about the marketplace. And you can see in this link there are some sample letters online for you to use. Next one to be aware of is MLR rebates. Part of the law is a requirement that insurance companies use a certain amount of the premium dollars to actually pay claims. Makes sense. That's about 80 or 85% depending on some factors. If an insurance company goes past that, which means they use less than 80%, 80 cents of the premium dollar are used to pay claims, they have to rebate some of that premium back to the policyholders. Where it gets a little complicated is if you have a small business plan and you share the premiums with your employee. So that means that a share of the rebate belongs to both of you, and then there are also tax implications because you've been withholding that premium on a pre-tax basis. There's an easy way out of that, just so you're aware of, and that's to use that rebate for a premium holiday. That means that it's being shared in the same percentages as the contributions were originally shared. It means there's no tax implications for the individual. So just something to keep in mind, and some folks in Maine did get MLR rebates last year. I think there's less likely that you'll get them in years going forward as the insurers get more familiar with these rules, but something to be aware of because it is a little bit of a trap if you get this check and you start spending it on your own. Next is the SBC, the Summary of Benefits and Coverage, and that's that easy to understand listing of what's covered that I mentioned earlier. New hire waiting period. Again, this is something to be aware of. If you are offering coverage, you may have a certain waiting period. That can now no longer exceed 90 days. And that is, in effect, exclusive of the requirement to provide coverage. Obviously, under 50, you have no requirement, but if you do provide coverage, that waiting period is limited. W-2 disclosure, and Roger mentioned these, and whenever I discuss this, I have to start off initially saying this is not taxable income. The way to think about this is the 401k box on your W-2 form. And if any of you have a spouse who work for a very large firm, you may have seen this already. It is in place for firms who issue more than 250 W-2s in a year. It's been delayed for most of the people in this room for the past 2 years. I expect it will be a requirement next January when you're completing your 2014 W-2s, as we expect further clarifying regulations on the employer requirements. You may recall the mandate for large firms was delayed for a year. That was to make sure the requirements were clear and more regulation had been issued, and I think this W-2 issue will go along with that. A few other things. This next one Roger covered in more detail than you have here, and that there are new rules with respect to FSAs, NHRAs, and HSAs. So we'll leave that as it is. The next one, there is a tax increase that you should all be aware of. And if any of you in the room are making more than $200,000 a year, you have seen your Medicare tax increase. And I will leave it at that. There's also some fees. You know, we talked about the law trying to get us down the road to universal access to coverage. It does more than that as well, obviously beyond the scope of what we're going to cover in this short presentation today. But one of those things is an emphasis on quality and on improving the care delivered. Because in the long run, the way we're going to free up resources to make sure that everybody is covered is by doing a better job of delivering that care. So this final bullet, the PCORI, or Patient-Centered Outcomes Research Institute, is designed to do more outcome-based research to make sure that we're getting the best possible care. And finally, simple cafeteria plans. As Roger mentioned, the tax implications of premiums is a huge deal and is really important when you're thinking about employer benefits. The way it's done is through a cafeteria plan. For the very smallest employers, at times the paperwork, the filing was too complicated. So now it's even easier for those with very small workforces to create these cafeteria plans. I'm going to gloss over these next few slides because we do want to be very respectful of your time, and we know you all have busy schedules. This is information on what your employees, or what you, if you're not providing yourself coverage, have available with respect to subsidies. And again, Roger covered this to an extent. This chart, the key column in this chart is the third column, and that's the way the subsidies are designed is so that individuals at different income levels have to devote a certain percentage of their income to their premiums. And you see at the very lowest income levels, it's 2%. It goes up to 9.5%. If that 9.5% sounds familiar, it's because that's what Roger said is the affordability threshold for employer-sponsored plans. However, it's worth noting, and we're going to come back to this in just a moment, that for an employer plan, you're not offering a sliding scale like this. And that gets at whether or not your workforce is better off on the individual market or with a plan that you're providing. And so this is another factor to keep in mind in terms of what the employees are facing. There's other financial help as well, some cost-sharing assistance for the lower income levels, and an out-of-pocket spending limit that now applies not only to small group plans and individual plans sold on the marketplace, but actually all insured plans sold on or off the marketplace. So that is the maximum amount of money, $6,350, that you can be expected to spend on your cost-sharing requirements if you go to in-network care. And I'm sure all of you read the papers. You know there have been some new innovations in Maine with respect to network-only plans. Those types of plans have been around the country for a long time, but we're seeing them for the first time with respect to some of the Anthem marketplace options, and I'm sure they'll go into some more detail about that. So we refer to the affordability problem that Roger mentioned as the family glitch. I also sometimes refer to it as the most expensive typo in history because of use of the word individual, use of the word household income instead of individual when determining affordability on the marketplace. And so, again, another factor you need to keep in mind when thinking about what's best for your employees. Dirigo was popular with some people, very unpopular with other people. But one of the things that it did that was actually more generous than the Affordable Care Act was with respect to employer coverage. If you offered a Dirigo plan to your employees, they could still get premium assistance. And that is not true in the Affordable Care Act, as Roger laid out for you. If you're offering coverage, the individual is not eligible for subsidies if it meets the requirements discussed. And so again, another factor to keep in mind when thinking about whether to offer coverage. I'm going to skip through these as we wrap up and get to the last two slides. You as an employer have three options. And again, we're talking now about the small employers, those with less than 50 FTEs. You can offer coverage to employees and dependents. You have the ability to offer coverage to employees only and not offer it to dependents, or you cannot offer coverage. How do you make that decision? The first thing that we have to acknowledge is there are always going to be winners and losers, even within your own workforce. The answer that each of you comes up with is going to be a very unique answer based on your business, based on your employee demographics. If you have a very high wage workforce, then this isn't really an issue because they might not be eligible for subsidies anyway. It's those of you with a lot of low-wage workers who really need to think through what's best for you, because obviously if your business isn't viable, then none of this matters. So what's best for you and what's potentially best for your employees. And again, that tax provision is a big deal. The fact that if you provide coverage, it's pre-tax dollars. If they go to the marketplace, it's post-tax dollars. Somewhat countermanding that is the subsidy issue. If they go to the marketplace, the low-wage employees will be eligible for some subsidy as opposed to not being eligible for a subsidy. So again, an individual decision, your broker can help you, your tax accountant can help you, and I wish you all the best of luck in figuring this all out. So with that, the slides have some more requirements, and I think we're going to go to a few questions for Roger and me. Yeah. The question is, when making the decision whether to offer employee-only coverage or employee independent coverage, can you have different classes? Now that I've repeated the question, I have to honestly say I'm not sure. There are non-discrimination rules that are part of the Affordable Care Act. I'm going to ask Roger if he has a more thorough response.
Sure. Traditionally, it's been kind of a quirk in the law that insured health plans do not have non-discrimination rules. And in the Affordable Care Act, there are non-discrimination rules, but they were put on hold indefinitely by the IRS a few years ago. And it's funny, I was listening to an IRS forum about 3 weeks ago, and they said they would issue guidance likely this year in 2014, but they've already said before that guidance will only be prospective. So with respect to your question, if you wanted right now to offer insured coverage to a certain segment of employees and not to others, that should be okay. You couldn't do it with a self-insured plan because there are non-discrimination rules there, but with a fully insured plan, you could do it for the time being. But it looks like on the horizon, that's potentially not going to be available. One last question on this point, though. It's just like a retirement plan. You don't have any discrimination unless you have a highly compensated employee participating in the benefit. So for example, if you offered coverage only to a certain segment of employees and none of them were highly compensated, which really means that either they're generally an owner or earning over $115,000 in the prior year, then you don't have to worry too much. The discrimination rules aren't concerned with discrimination amongst non-highly compensated. They're only concerned with the haves and the have-nots, so to speak, okay, if that helps. So for the time being, it looks like you may be able to benefit one segment of your population through a fully insured plan. Yes, the question was, what about deductibility in the case where a sole proprietor had employees in the past, but has now changed his business such that he no longer has employees, he or she, and is only self-employed?
We disbanded the group coverage for individual coverage.
Yep, he disbanded the group coverage for individual coverage. Really, it doesn't change, because before, when he had group coverage, he would deduct his employee premiums on Schedule C, on his business return. He would deduct his own premiums as a self-employed health insurance on page 1 of his 1040. You've had that deduction for some time now. And I think if you went to an individual sole proprietor situation where you had no employees, if you're purchasing coverage, I believe, and this is, that you can still take that self-employed health insurance tax deduction on page 1 of your 1040. So you're not going to lose your deduction, I don't think.
Ditto to what he said, but I did want to add one other clarification. The small group definition has actually changed at the lower end, in that sole proprietors, if you have a group size of 1, you're now considered part of the individual market, and you would go to the individual marketplace. A group size of 1 can no longer buy a small group product. So that's a slight shift when thinking about sole proprietors.
Would that include a sole proprietor and their spouse? Would that be 2 or 1?
I believe that's still 1, but I'll look to my, I'm getting a nod from Anthem, it still goes to the individual market.
That's the same way it is for tax.
Great. Well, help me in thanking Roger and Mitchell for a very succinct, complicated presentation.